Paul, you can begin.
Okay, good afternoon, everybody. Thank you all for joining us. As usual, before we get started with our community briefing, today we have a translated version of this broadcast is being streamed live now. Gilbert?
Buenas tardes y bienvenidos a la sesión informativa donde la doctora Mase nos dará una actualización sobre el coronavirus. Esta actualización se está transmitiendo en vivo por nuestro canal de YouTube con la interpretación al español. Para escuchar la versión en español, puede usar el link de YouTube que se encuentra en la página de Facebook del Condado de Sonoma. Gracias. To you, Paul.
Great, thank you, Gilbert. Once again, I'm Paul Gullickson, Communications Manager for the County of Sonoma, and this is our COVID-19 update for Wednesday, November 25th. We want to remind you that during this update, we will be taking questions from the public, and you are invited to submit questions either by emailing them to us at publicaffairs@sonoma-county.org or by just leaving your question in the comments area of the Facebook Live page that you're on. We also ask all those who are going to be joining us as panelists to speak loudly and slowly for the sake of our interpreters. So let's begin with a brief presentation by Dr. Mase.
Great, thank you so much, Paul, and thank you everybody for joining us today. Sonoma County remains in the purple tier within California's blueprint for a safer economy. But the good news is that our adjusted rate of daily cases per 100,000 population has dropped significantly. It's now down to 8.7 as of this week. And as a reminder, just a week ago, it was at 15. Our testing positivity rate has also decreased and is at 3.6%, which also shows continued forward progress over the last several weeks. The state has not updated the county equity metrics this week. Although these metrics won't change our status, our case rate still puts us in the purple. They are encouraging as they demonstrate the progress we're making thanks to our robust multi-pronged strategies for reducing transmission rates, including more than doubling our testing opportunities, offering financial assistance for essential workers so they can stay home when they test positive, providing hotel rooms to allow for isolation so COVID positive individuals don't put their family members or roommates at risk, boosting outreach to impacted communities, and fostering more partnership within the business community to help address the COVID crisis and to support one another. Sonoma County's progress in improving our metrics demonstrates that these strategies are working. It shows that we can do as a county, what we can do as a county when we all work together to slow the spread of COVID-19. To get out of the purple tier. These efforts, though, do not supersede the emergency brake pulled last week by the governor's office and state health officials. More than 94% of California's population, including Sonoma County, is now placed in the most protective or restrictive purple tier. The state is reassessing data continuously, and movement between tiers will be based on closely watched factors such as new cases and hospitalization rates. California has also issued increased mitigation measures, including strengthened face covering guidance and a 10 p.m. to 5 a.m. curfew on non-essential interactions with non-household members to curb social gatherings. Keeping the curve flat in Sonoma County is extremely crucial right now. We understand the desire and peer and family pressure to gather this Thanksgiving. Traditional events and meals are important for our social and emotional well-being. As important as this is, however, we're still strongly encouraging you and your family to steer clear of indoor gatherings with mixed households this year. With some excellent vaccine candidates that are rolling out soon, we still need to keep transmission rates low for the next few months to ensure as many people as possible make it to next Thanksgiving. If you insist on gathering indoors with those from outside your household, remember to keep household members in groups and maintain 6 feet of distance between each group. Leave windows open with the heater on to allow the air to circulate. Don't share food or utensils. Keep the event short. Outdoors is always better, even though that may be challenging given the cold. And of course, wear your mask at all times, except when eating or drinking, and wash your hands often. Well, thank you very much. We now have a few minutes for questions from the community and from the media.
Great. Thank you, Dr. Mase. So again, we just want to encourage those in the public who'd like to leave a question, go ahead and just leave it in the comments area of the Facebook Live down below. We have a couple of questions today about shopping. A number are concerned. They are still gathering things for Thanksgiving, but they're finding grocery stores are pretty crowded. I know Trader Joe's is very careful about not letting, I think it's 25% capacity in their store, but some stores are not monitoring the front doors. What guidelines do you suggest for people who go shopping?
Well, certainly, wearing the mask is really important. Make sure that you wash your hands. Don't touch shared surfaces. If you can help that, you can take a wipe with you to wipe off surfaces if you have to, place your items on the counter, things like that. If you feel like there's too many people in the store, wait and go at another time. I think the other option is online grocery shopping. Many of the stores are providing that service. So you might be able to order online and have the food delivered to you. That's another reasonable alternative.
That's a good idea. Some have pickup out front, so you never have to go inside as well.
Yeah, curbside pickup. That's another great idea.
Yeah. Mike, he's one of the listeners on Facebook, he's asked if the health equity tier were still being considered by the state, would we be qualifying for the red tier status? And if so, or either way, do you know when the state might be updating the health equity metric?
I'm not sure when they're going to update it again because we have that emergency break right now on the tier system. However, there's a good likelihood we could be in the orange with the health equity metric. It just depends on, again, the denominator of testing, which, as you know, is increasing significantly in the lower 25% quartile.
Great. Thank you. One person corrected me. They said Trader Joe's were not monitoring as of yesterday. That's good to know. They're usually pretty good about it. And one person noted that, in fact, the only one they've seen is Sonoma County limiting the number of shoppers is Walmart. So that's good information for the public. Let's switch over and take a question from our members of our media. We'll start with Martin Espinoza from the Press Democrat. Martin.
Hi there. I have questions about hospitals and some of these rates that you're talking about, but I wanted to ask first, the members of the immigrant rights community advocates held a press conference this morning. I saw that Paul Gullickson attended that or listened in on that press conference on a Zoom call. They talked about just wanting more to be done about addressing the disparity and how COVID is not only impacting these communities, particularly the undocumented community, not only their health, their economic well-being. They talked about not being sick leave or not having enough time for sick leave. I was just hoping to get, and then, they did welcome things like the Cura project, but they said that this was kind of a drop in the bucket, I think is one of the, if I can characterize that. And they were just hoping that more could be done. And I was hoping that both you and Dr. Mase and Paul could comment on that. Paul, since you attended the press conference.
Well, I'll be happy to go first since I was at that meeting. I found I felt it was a very productive meeting, sharing in particular, this was a group whose primary focus was representing the struggles particularly among our undocumented community. And they had individuals sharing some of the real challenges they've had in trying to do the right thing and isolate, but then not being allowed to go back to work or losing their jobs because of it, and not having the financial support that they need to just make ends meet while trying to deal with COVID. And we certainly, you know, feel for them in this situation. And the county has created programs that are really trying to address those needs with the financial assistance, both for while they have to isolate for COVID positive individuals, but also for rental assistance. And so I know they expressed a desire on a number of fronts. And Martin, I want you to know that we are reaching out to them. I had a meeting with some of my comms team members right after that, and we are going to try to reach out to them to see how we might hear more about what they're experiencing and how we might be able to connect them with some of the programs that do exist they may not know about, including the programs through the Cura project. But Dr. Mase, I don't know if you had any thoughts in general about what more we could be doing, particularly to support our undocumented community and some of the isolation they're feeling and the lack of support.
Mm-hmm. Yeah, I think we're still trying to find more hotel rooms that could be alternate care sites to support specifically that vulnerable population. I also think we're just starting to ramp up the financial package that we're giving for isolation for people who are diagnosed in the lower 25% during that isolation period, the 14 days of 1,216. So Martin, I think that's just starting and will be ramped up significantly here in the next month.
Have any funds been released of those? What do you mean by ramped up? Does that mean, can you give a sense of how much money has been provided?
Yeah, I'm not sure exactly how much, but Paul, we can check and see where we are with that. What I mean is that it's you know, we've gotten all of the processes in place to start giving those funds. I don't know how many have been dispersed yet, but certainly once the process is in place, it'll be a lot smoother. Paul, maybe we can check on that.
Yeah, I will say, I'll check on the exact amount, but I know it was in excess of $700,000 that there was one round that was committed to that program, primarily through Cura project to provide financial assistance. And that met a huge demand, and they're showing a greater need. And the Board of Supervisors has authorized another round of assistance, particularly in that area of providing financial assistance for those who have to take time off from work to isolate or to distance themselves from family members to keep them safe. So I can get you the exact number on that, Martin.
Yes,
So.
just one of the points they were making is that there's still a lack of awareness that these funds are available in the community.
Yeah. Well, and one of the questions that did come up during this morning, Dr. Mase concerned a desire for streamlining test results or having a quicker turnaround on our test results or having more opportunities for testing. You want to talk about that a little bit? I know we have been stepping up some of our testing opportunities, or will be, in the county.
Yeah, there's numerous ways now to get tested. First of all, there are our pop-ups, which we've significantly increased over the past month. I think we're doing like 12 pop-ups a week now, primarily in the census tracts that make up the lower 25% quartile. And so anyone can come and get tested at those sites. The turnaround time for those tests is 24 to 48 hours for results because our lab is processing those specimens. Then we have OptumServe, which is a state-run site. There, the turnaround time is a little longer, can be up to 4 or 5 days, is what I've heard recently. There is the Santa Rosa Fairgrounds site, which will be adding another lane. There's 2 lanes performing about 300 tests a day for capacity, but we're adding another lane to that. So that can be probably closer to 450 tests can be performed daily there. The Windsor site also has 2 lanes, able to perform 300 tests a day there. And then we are getting a new fixed site in Petaluma I'm not sure when that will get started, but the state has already allocated that for us with another capacity to do 300 tests. Again, the turnaround would be a little bit longer if you go to OptumServe. So it means that if you're sick and you're worried that you have COVID, you should call your doctor and try to get prioritized for testing with a shorter turnaround time, rather than going to OptumServe where it might take, like I said, 4 to 6 days to get your results. In addition, there are numerous private labs that are offering testing in our county. And as I noted, they are getting on board with the reporting as well. So ADX is one of them, and that is a fee for service, however you pay for that test. That's not free testing. So they guarantee a 24 to 48 hour turnaround time as well. So those are some ways in which you could get tested and the different times it takes to get results.
We had another
also
question
our federally qualified health centers are testing as well. That's all the health centers, and the hospitals are testing as well. Yeah,
and we want to remind everybody that the best option right away is to try, if you do have health insurance, try your healthcare provider to see if they can provide a test for you. Sometimes they have very quick turnarounds and appointments available. We had a question about how restaurants have the question about the tents and canopies, and how the rules allow only 1 full wall and 3 open walls. Do you want to talk about how those rules have been? I can say we have amended those rules in consultation with the fire chiefs. Do you want to talk about that a little bit, Dr. Mase?
Yeah, I mean, I know, Paul, you may know more specifics about the exact proposal there, but there is not even a proposal. It's actually a guidance that allows for the outdoor dining with modifications that would make it easier, given the inclement weather that's coming our way, for restaurants to keep the outdoor spaces open. I don't know, we don't have Adam on the line to discuss this,
yeah,
but I don't know, Paul, have further specifics about that.
Well, there's a lot of flexibility that the new guidelines provide, including the fact that they still cannot have more than 1 full wall, but the other walls, there can be at least 50% airflow. So there could be some half walls that they can provide, and there are also a lot of questions about heat lamps. So they have heard some of the concerns from the restaurants and trying to make those a little more accommodating, and I think these new guidelines will help along those lines. So we also have a question about, and those guidelines about the tents and canopies are unavailable on the socoemergency.org website, as well as a press release where we announced those new guidelines. We also have some questions about the best way to get, whether you can do walk-up appointments for some of these tests at the pop-up tests, or what's the best way to get a test is the question.
Yeah, and the best way, you can share the number for making appointments or the website for sharing the appointment. It's best to make an appointment, because then you have a set time and you'll show up and get tested. However, we do accept walk-ups as well as the pop-up testing, and I believe the pop-up testing schedule where we're testing and when is up on the website as well. So
yeah,
that's right, Paul?
Yeah, that's the best way to get a test appointment, is to go to socoemergency.org/test. And that will take you immediately to the testing page, where you see all the options available to get a test, including at OptumServe and the pop-up sites. The pop-up sites will give you a map, a calendar, where you can see where all of them are located on each day, and you can make an appointment. It also will indicate whether or not you live in one of these census tracts where we're really targeting those for those pop-up sites. So that's really the best way right now. Our phone lines are a little backed up in terms of phone appointments. So doing it online is the quickest way to get an appointment right now. I'll let you know. So,
and remember, Kaiser is also offering testing. And the last I talked with Kaiser, people were able to get appointments quickly. You do not have to have symptoms. You can call and get a test through Kaiser if you have that insurance.
Yes, thank you for bringing that up. Let's go back to Martin. Has another follow-up. Martin?
Everybody else must be on vacation, right? I'm the only guy here. So I'm doing a story about hospitals and their preparedness. It's a little different here in the county. We're not experiencing the surges that other counties, even in California, those that were actually doing better than us a few weeks ago, or the really troubling surges that states across the country are seeing. It almost feels like we're kind of in a stable position right now. So we're not actually seeing a lot of demand on hospitals in terms of COVID patients and ICUs. How would you characterize where we are right now with our hospitals, and what would you expect to see coming into into December, where a lot of people are worried about that?
Well, I think we're doing a pretty good job here in Sonoma at keeping steady. As you've said, we've seen a slight increase in case numbers, but not nearly the kinds of increases that the other counties have seen. And it's possible because we've been in the purple and that things haven't really been open like they have in some of the other Bay Area counties. It's also possible that we're behind in timeline and that we're going to see a greater increase here over the next month. And of course, you know, the better that the community can stick to the mitigation measures this holidays season, especially Thanksgiving and the weeks following, the better off we're going to be in terms of preventing that surge. So I want everybody to really focus on that, because we do want to be able to move into the red when the state again allows us to move forward, because I think we're trending that direction.
Thank you.
Okay, on that point, Shelley on Facebook asks, she's asking, what is the status of our COVID-only hospitalizations and ICU capacity of COVID-only patients in Sonoma County today? If we have those numbers, certainly we're hearing about huge impacts on hospitals across the country. How are we doing on that front?
Yeah, maybe I'll have Kate speak to that. I don't know if Kate, if you have the up-to-date information on that, or we can supply it to Paul, but Kate may be able to fill that in.
Hi there, I'm just pulling up the information right now.
Thank you, Kate.
Okay. Okay. So it looks like for confirmed COVID cases, as of November 22nd is the last. Let me just expand this. Let's see if we have a more recent one here. Okay, yeah, it looks like 30 cases, COVID confirmed. And sorry, this is taking a moment. Okay. So sorry, here, I found the right page. Okay, so yeah, 30 cases of COVID confirmed, and then with ICU beds, we currently are at 3.7% capacity. We have been, with our ICU beds, we have been under the 20% capacity that we would like to see for a long while. I would say back since about May or June or so. So that's been pretty consistent for us. We do have a lot of surge capacity in our hospitals. So even though those ICU beds are low, there is capacity to expand beds as needed if hospitals need to. And so far they have not had to dip into that surge capacity.
Great. Thank you, Kate. Okay, Martin, did you have a follow-up?
Sure.
Your hand is still up.
Yeah. I was just at Memorial this morning, and they said they had about seven patients currently and no ICU patients. So 7. So they said they're doing pretty good. And again, reflects that we're kind of not seeing the surges that other places like Texas and hospitals there are seeing. We would, again, we are on a sort of a 4-week lag, and Dr. Krilich talked about that. I think he was in a call with you this morning, Dr. Mase. But when would you see the number of cases that we see later translate? Some of those will later translate into hospital cases. What would it have to get up to before we saw a surge? Like if we were to see, in terms of cases per 100,000, what kind of a case rate would we have to have before we saw a troubling surge weeks later in our hospitals?
Yeah, sorry about that. Yeah, I mean, I think that hospitalizations would really be driven up if we saw more cases in our vulnerable populations, like the congregate settings, skilled nursing facilities and residential care facilities for the elderly. It was at the time when we were having outbreaks in those congregate settings that we had the most increase in hospitalizations and ICU admissions. So right now, with all the interventions we put in place and the surveillance screening of staff that's happening and all of the other measures that we put in place along with the state, with the skilled nursing facilities and the RCFEs, we're not seeing huge increases in that arena. So I think that probably more impacts hospitalizations than our actual case rate. I don't know if Kate wants to add to that at all.
No, I would have said the same thing, that it really depends on the demographic characteristics of the cases and whether they're 65 plus or have other underlying medical vulnerabilities.
So I'm looking at the chart, the hospital capacity chart, and are you referring to those summer months of July and early August when we saw pretty much double what we're seeing in terms of hospitalization?
Yes, and it was really in like late July to mid-August, even mid-July to mid-August, when we were seeing the large outbreaks in the congregate facilities.
Got it. All right, I don't have any other questions.
Okay, we do have another hand raised from Susan Walbarst. Susan?
I just wanted to know, you said you're doing your pop-up testing in the census tracts. I wondered about the fact that you report the cases by zip code. And I wondered if there'd been any thought to doing testing in the zip codes that are reporting the most cases.
Yeah, thanks for that. Zip codes don't map directly to census tracts, and we could use either, really. But since the Healthy Places Index uses census tracts, that's how we're able to see where that lower quartile of our population in our county is. I'm going to have Kate answer the question about the zip codes and testing in the zip codes and how that maps to census tracts.
Yeah, I would just say since the beginning of the pandemic, we have been looking at a number of data sources to help inform our testing and case finding approach. And that includes mapping all of the cases that we've seen in the county and being able to see where there's higher density of cases, where we have higher case rates, and that has informed where our testing outreach occurs. And that aligns, the data tracking that we were doing also aligns well with what we've seen looking at the lowest quartile of the Healthy Places Index. And as Dr. Mase said, the census tracts don't align perfectly with zip codes, but I would say that the direction that the data provides us is overlapping in terms of what we learn from looking at census tract level data and what we learn from looking at zip code level data.
Thank you.
Okay, well, it's a little after the top of the hour. I just want to note we have quite a number of commentary today about how crowded the grocery stores are. So we encourage people to be safe out there and maybe avoid those stores that aren't carefully monitoring how many people go inside. You know, we want to make this a safe Thanksgiving for everybody. I also want to, as I promised, give you the phone number to call if you live in one of those census tracts and you would like to take advantage of those pop-up testing. The number is 707-565-4667. That's 707-565-4667. That you can make an appointment for one of those sites. But again, the best way to make an appointment is to go to socoemergency.org /test. And that page will present you with all the different options for testing and the phone numbers, as well as an online link where you can make your appointment online. So please take advantage of that. So with that, we're going to wrap this up. Once again, I want to thank Stuart and Sylvia, our producers today, as well as Gilbert and other members of our crew behind the scenes, including Jordy, our Spanish interpreter, and Brenda, our AS, as well as Kate, our panelists, for being with us today. We invite you all to join us again on Monday at 3:30 p.m. for our next Facebook Live update with Dr. Mase. Until then, we encourage you all to stay safe and have a happy Thanksgiving.